Today is Wednesday, July 25th, and we are going to have our Citizen Oversight Committee for the Mental Health Treatment Act, Measure B. Thank you for being here. We will have not open mic, but public comment here in just a minute, but I'd like to ask Dora to take roll, please.
Janine Miller is absent by prearrangement. Jan McGordy, present. Carmel Angelo.
Here.
Case Barish is absent by prearrangement. Ross Liberty.
Right here.
Lloyd Weir.
Here.
Mark Myrtle. Jed Diamond.
Here.
Shannon Riley. I'm here. Thomas Allman.
Here.
Donna Muscati.
I'm here, I'm right here.
He's still here.
I still are.
Thank you very much. We have agendas in the back, and with some attachments, there was at least one attachment came in after the agenda was printed, and it's the license requirements for psychiatric health facilities for PHF that Director Miller supplied to us, and there's copies in the back if you'd like it. But it will be attached on the electronic version of this, so people can read the question that came up regarding 2 meetings ago, the license requirements for psychiatric health facilities. So with that, we will move on, and we have the minutes from June 27, 2018. I was not here.
Tom, before we do that, could we address the agenda, approve the agenda?
If there's any changes, nope, we're gonna do the minutes and we'll address the agenda.
Okay.
So, has anybody would anybody like to make a motion, the second, to approve the minutes?
I so move.
Jed Diamond, is there a second?
I'll second.
Lloyd Weir, second. Is there any discussion? Is there any public comment on the minutes from June 27? None? All in favor? Aye.
Aye.
Any opposed? Hearing none, minutes have been approved. And Dora, could you record show that Mark is here?
Thank you, yes.
Okay, so the agenda for today, is there anybody who would like to make any changes to the agenda? Jan?
Yeah, on item 5D, regarding responding to the resolution from the city of Willits, I had questioned if that should be on the agenda, and the county council informed me that we should have discussed that.
I think there's still some, and I understand, because I talked to county council too. I'm gonna leave it on, and we'll talk about it, because as we go along, I think you'll understand what we're doing.
The other thing is, on 5E,
E is in Edward.
yeah, Mark Myrtle and Janine Miller were gonna talk about, psychiatric health facility, but Janine isn't here, so I wasn't sure if we needed her to carry on that discussion.
When we get to that, we'll talk about it, because I think that what Janine supplied us, the license requirements, are certainly going to play into that conversation. So even though she's not here, we'll still talk about it,
Okay.
then we'll move forward. Okay, so we've approved the minutes from June 27th, and have there been any communication since the agenda went out?
So,
No communications. Public expression. Is there anybody who would like to give public expression? Please state your name for the record, and you have 3 minutes to talk. Okay, so there's no public expression. Open public expression for items that were not on the agenda. So moving on to discussion and possible action items. 5A, Member Weir will discuss the report on Measure B tax funds expenditure report with discussion and possible action. Lloyd.
Yes, Chair Alwyn, thank you. Have a copy of a receipt from today, actually, right off the press. A wire came in for our second monthly installment of Measure B sales tax, totaling $591,270.18. So this is our second month. We now have a 2-month total of $1,108,329.27. So these funds have been deposited into the special revenue fund, solely separate from all other funds in the county, to accumulate in frugality, and I am going to be reporting out on those on a quarterly basis, so I'll give you a quarterly report. The latest estimate that I had is the actuals are actually coming in ahead of my projections, so sales taxes are performing well right now, and so just to keep everybody informed, the county does have a sales tax consultant that we contract with, and one of their new programs is to help us project the Measure B sales tax total. So not only will I be projecting them for you here, but I'll also be taking their input as they give it to me, which is quarterly. So we'll have two sources of independent eyes looking on the sales tax. So right now, $1,108,329.27 is in the account. No expenditures yet. I did have a handout for everybody. It looks something like this. Just received it this week, and it is a summary of the countywide special election costs. As you know, per section 5.180.180 of the ballot measure titled Election Costs, which was approved by the voters, states that if the election results in approval of the ordinance at least a 2/3 vote for all the voters voting on the ordinance, the county shall be reimbursed for the cost of the election from the proceeds of the tax. So we now know what the costs are. They're in front of you there, so that'll be one of our first expenditures of the Measure B sales tax.
So, Lloyd, the total cost of the special election was $176,000.
Correct.
We're not assuming that Measure B is going to pay for the entire special election, are we?
You're right. This worksheet breaks it down between the county and the other two special districts who held special elections. So it's a total of all the special elections for the county, and the first column would be the amount towards Measure B.
So there were other issues on the ballot also. I mean, so the county, $161,577.84. There's this, that saying that Measure B fund would reimburse for the entire county special election.
Just for
portion?
the special part of the election, any ballot measures that are over and above the election. So that would be this column here.
Okay. All right, any questions on,
Yes, does that mean,
wait, hold on a second. Any questions from the commission?
sorry,
Good?
Yeah, it sounds like we're getting into this. What other, I understand the costs that will be reimbursed by this will come under that county column. And what other elections, I can't remember, what else did the county have on the ballot other than Measure B that's coming, that we're looking at?
Yeah, the sanitation district and one of the water districts had measures also.
Okay,
So those,
so how do you determine who pays for the reimbursement then?
so those two districts will get billed and pay for their share of the special election.
And their share, how's the
Look
share
at column
determined?
2 and 3, Jed. Look at column 2 and 3 there.
Oh, okay, is that,
Yeah.
So the delta is really large. So, but I get, right, the sand district had 4,500 votes, for example, 4,500 actually people. So probably 1,000 votes.
gotcha, okay.
That's why the delta's so much.
Yeah, correct. And this spreadsheet was prepared by Sue Ranich.
Okay, so the only thing that was on the ballot at the county, the only county measure was Measure B.
Yeah.
Got it, that's what I.
All right, do any commissioners have any other questions? Yeah, Mark?
so the costs were allocated based on the votes?
I would assume it's the number of votes. I can verify that with Sue Ranich, but I will do that. but I'm pretty sure, and she is available if there's any questions, we can get her in.
Okay, public comment. Are there any comments from the public regarding this? Okay. Hearing none. So. We want to move on to item number 5A, Stepping Up Initiative with discussion and possible action. So the Stepping Up Initiative as is for those of us who, for anyone who is not aware of what the Stepping Up Initiative it's actually at the federal level and came down to the state level. Stepping Up is a mental health conversation starter. Stepping Up is a mental health conversation starter to work specifically with local government and mental health initiative. And matter of fact, in the agenda that went out, the Board of Supervisors passed Resolution 15-079 in 2015, and just the title of it, let me tell you the title of it, Resolution of Mendocino County Board of Supervisors in support of the Stepping Up Initiative to reduce the number of people with mental illnesses in the jail. And it's attached, and there's copies in the back if anybody would like to see, and electronically there's copies also. And so I've met with committee members Wardy and Miller regarding this, and we're actively trying to organize a first responder training in September, 3 separate dates of 2-day training for first responders, law enforcement, fire, and ambulance, with the monies, at this point, $150,000 that would be used to pay the cities that would backfill their positions if they can get law enforcement officers there as well as fire departments. And there's discussions about the funding and so forth. So at this point, we're on track for training this fall that will be well publicized for Mendocino County first responders. Jan.
Yes, I want to point out that the main purpose of Stepping Up initiative is to jail diversion. So, and the most important piece of this is to get collaboration between the different systems within each governing body, which would be criminal justice, mental health, and the jail system. So that's really the most important piece, and I, understand I've been pushing for CIT training for 4 years, don't it? But I think we really need to look at getting this team together to see how we can get our systems to work together. And hopefully the results of the Kemper's report will show the holes that are in the systems and where they don't overlap. But I think we shouldn't limit our thinking to just thinking it's training first responders on how to recognize mental illness and how to manage de-escalation.
Thank you. Anybody else like to comment? Carmel.
Sure. When I went back and read the resolution most recently, it occurred to me that I agree with Jan as far as the systemic approach on this, but I really think that, it's really going to be around the jail, right, and assessment as people come into the jail, assessing them for mental health, if you read the different activities here. So I was thinking, Sheriff, that at some point it would be good to involve NAFCARE and your consultant and to really look at how you can begin doing some of these activities that the Stepping Up Initiative calls for within the jail. So that would be my suggestion. And also, I am thinking that this is the only time that Stepping Up will be on the Measure B agenda because it's not part of Measure B.
Right, I agree, and actually I wish it had been entitled, it's my fault, of responder for training for first responders, and then we could talk about measure for stepping up, assisting and reimbursing and covering, most of the costs. Just as I presented to the board in May, the average daily population in the county jail for Mendocino County in May was 305 inmates. And the average number of inmates that were taking some type of mental health medication was 111, which is astounding. So over a third of inmates that were in our jail in May were taking some type of psychiatric medicine. What I don't want anybody to think is that once the stepping up money has been expended, that we're going to stop training, working with the NAMIs or the other agencies, the nonprofit agencies throughout our county, because I think that stepping up is just, it's stepping up. It's stepping up to the first step of trying to get a grasp on what's plaguing local government since the closure of state mental health facilities in the early 70s. And so, Jan, I agree with you, but my focus is to take a very big first bite of the apple to say, because first responders are usually the people who have the first focus on the 911 call of someone who is mentally unstable, that's where we're going to do the vast majority of diversion from preventing them from going into jail and getting them into the mental health system.
So I have another question, and that is that my understanding was that $150,000 that was allocated to stepping up in 2015 has vanished.
Okay.
So,
All right, so we have our auditor here, maybe he could address that.
Yeah, Lloyd Weir, Auditor Controller. I've gone back through the records and have a copy of the 2015-16 final budget. And I'll read to you the CEO's recommended comments. The Chief Executive Office recommends approval of the submitted budget, which includes the transfer of $250,000 of one-time money to be used in mental health for a pilot project related to Stepping Up initiative to reduce the mentally ill jail population of $150,000 and for the implementation of Laura's Law for $100,000. So that $250,000 was approved at the final budget. So I've gone back and traced the actual transfer of the dollars from the general fund, and the $250,000 was transferred into the mental health fund on October 1st, 2015. Once it's in the mental health fund, that is a special revenue fund, and all funds that are received in that fund would remain until spent. So as long as nothing's been spent on those funds remain in the mental health budget fund balance for future expense. So that's my research.
Thank you.
So I just want to clarify for me. So you're saying that $150,000 is still in the mental health fund?
As long as there's been no expenditures on it.
Okay? Okay. Dan, or Carmel?
Did you want to say something first? No. Okay. So, given this information, because really we do sweep general fund, though we don't sweep from mental health, so this is good to know. I think that offline we probably need to talk about another very brief presentation to the Board of Supervisors, again, separate. This is Measure B, stepping up is separate, that we would do that and we would talk about what the next steps are with Stepping Up initiative. And possibly, you know, I think really since it has to do with the jail, that we would see a more active rural sheriff with you with the $150,000 Stepping Up.
I'm all for that as long as it doesn't delay our progress of getting training.
We have board meetings twice a month.
Okay, to get training, you know, as soon as possible.
The training goes, the money's there, the direction is there. I would like to see us do an update to the board.
All right.
And really talk about the different actions that need to happen with Stepping Up, that need to happen in your jail.
So we at the Sheriff's Office are, we're lucky enough to have hired the retired Ukiah Police Chief, Chris Dewey, and he is putting together a syllabus of the training that's going to be given, not just to first responders, but it certainly will be open to members of the public if they want to go through the training as well in September. So I will put on the agenda for next month to give a syllabus of the training that's going to be presented to the first responders. But I'll gladly talk to the board before then. I don't think the board, once the money's in the budget of the mental health, I don't think we need an action by the board to approve the expenditure for the training.
Sheriff, I agree, we don't. What I'm really trying to do is two things here. One is to separate out Stepping Up initiative from Measure B, because the only reason that I see that it's on the agenda is because we had the discussion at the board level. Part of that discussion was there wasn't 150,000, and so this was referred to Measure B. That is no longer a problem, it's been resolved. And the second point being that I think Stepping Up deserves its own, its own time, its own meeting, its own structure. And so I'm hoping that we can get there, and my office will help you.
Thank you.
Thank you.
Any further discussion on Stepping Up?
Yeah, real quick question is, that as it speaks to both Stepping Up and to the Measure B, the first time I heard that the public would also be able to participate
Sure.
in the training?
Sure.
Oh, that's great, I didn't know that.
Yeah, no, it's not just first responder, the effect, the mental health situation has caused parents, teachers, nurses, everybody to have some type of interaction with people who are mentally ill.
Yeah.
And the Stepping Up initiative certainly deals with, what's that first contact of diversion from them going to jail instead of going to, say, a mental health hospital. And sometimes parents and teachers and nurses can divert even before 911 gets there.
That's great, I think that's really needed and valuable, and I'm glad it's gonna be made available to the public.
Thank you. Mark?
I read through the Stepping Up program, and I do feel that the Stepping Up program is relevant to Measure B because we want to divert people out of the jail system into the mental health system, and we need to know where they can go and where the facilities that they can go to is, and that's where I think Measure B is relevant. And knowing what's happening at the county level with the stakeholders, and maybe what we can do to offer services to relocate the mentally ill or the mental needs patients into some facilities is relevant. So I'd like to see at least a quarterly update on the progress of the Stepping Up program, because I do think it's relevant.
Well, there was no problem giving quarterly. I'm anxiously looking forward to telling you how many numbers of people went through the training. So, Ken?
Yeah, I would agree with Mark, because the whole reason that our jails are a default mental institution is because we don't have facilities that we're trying to create through Measure B.
You're here. That's my party line right there. Is there any public comment on Stepping Up initiative? Okay, that was Measure 5B. We'll go to Measure 5C, the Needs Assessment Progress Report with discussion possible action. Ted Diamond.
Thank you. So there are kind of two parts to what I want to share. The most immediate was, as all of you know, and everybody that was here at this meeting, and then since then, that I was appointed by this board to be a liaison with Lee Kemper in the needs assessment. And so I've met by phone with Lee twice, and part of my report will be what I'll share with you in a moment. Prior to that, we were all asked to submit any questions that we had that we wanted the needs assessment to address, which we did, some of us in writing, and then there was a meeting where all of us were asked to speak, the kind of the priority ones. So I had said in my writing part that I had a series of, 12 questions that I wanted the needs assessment to address, and I said unless the mental health people on the staff had some of those answers before it went to Lee. So I had asked Janine, and she reported back what of the questions I asked we already had answers to. So I want to say what those are. For those that have the Redwood Quality Management, these sheets in the agenda, Janine has posted a whole lot more information, but here were the questions that I asked that are relevant to the Kemper report. So one question I had asked was the number of clients that were placed out of county, since I knew that's where a lot of the people that we hoped we could be treating would be, could be seen. And in this report, I don't know exactly which page this is on, but I took notes from what was sent to me, that during fiscal year 2016, 2017, there were a range of 36 to 46, so 36 to 46 clients per month sent out of the area. And in fiscal year 2017, 2018, there was a range of 31 to 38 clients per month. So that's in this data, but she sent me the specific things to my questions. I asked also where people were being sent out of county, and there's a list of the facilities. Most of the people from our county are being sent to 3 hospitals, primarily one at St. Helena in Vallejo, Respad in Redding and Red Bluff, and Aurora in Santa Rosa. So right now, that's kind of where a lot of the people are being sent. I'd also ask that based, on what people are evaluated for when they're in emergency for mental health, there's 3 criteria. It's called a danger to self, a danger to others, or gravely disabled. And a lot of people are concerned about the danger to others because that's where it kind of impacts people, community. And I asked for a breakdown of those 3 categories between, and I got those. Those are on, again, one of the sheets here. It's called hospitalization, 72-hour hold, 5150, which is the mental health statute that you can hold somebody. So I think this is very interesting statistics. So in fiscal year 2017, 2018, a danger to self, 344 holds. So 53% of the total were a danger to themselves, somebody that's in danger of hurting themselves. The next highest category is gravely disabled, which basically means unable to take care of their basic needs. They're not able to feed themselves or clothe themselves or have adequate housing to keep them from, danger of freezing in the cold or not being able to survive. So that category, 153 people, 24%. And then the final category is danger to others. And only 12 out of that total are a danger to others, which is 2%. So really, most of the people that we're talking about are those first 2 categories, a danger to themselves or gravely disabled, with a small percentage being potentially a danger to others. So those were basically my questions that I wanted to get answers to. So you also have the notes. I spoke with, I'll try to speak up, I can see you're holding your ear. So I spoke with Lee Kemper twice, once on July 2nd and second on July 20th. And these were my notes from our phone conversation. So I told Lee that I had been appointed by the Measure B Oversight Committee to be a liaison to he and his staff, and I asked Mr. Kemper about the progress on the assessment thus far and whether he had received the written and oral suggestions that had been generated by the committee from earlier meetings. So he assured me that he had all the written information and that he had watched and listened to the videos when we all spoke. So he had all that information and assured me that that was being taken into account in his needs assessment. He said he had met with stakeholders in the mental health field and was moving as quickly but as thoroughly as possible to complete the needs assessment in a timely manner. He also said that he felt that Mendocino County was exemplary and ahead of other counties in the state in addressing mental health needs of the community, passing the tax measure to raise funds for additional mental health services, authorizing a thorough needs assessment that was being undertaken, and having a diverse group of people on the Citizens Committee to make recommendations to the board. So that was essentially our meeting on July 2nd. Then July 20th, I met with him or spoke with him by phone, and he indicated that the needs assessment is nearing completion and that he expects to submit his report to the Board of Supervisors and the Measure B Citizens Oversight Committee prior to our next meeting on August 22nd. So he said we should get his report prior to the meeting, so we'll have a chance to look at it, as will Board of Supervisors. So in response then to questions I asked, Mr. Kemper offered the following information. So he said the comprehensive needs assessment for mental health will address the following elements, and there were 12 that I just took notes on. So number one was, what do we have now? Second, what do we need? Third, how much money do we have to meet the unmet needs? So that's where we're getting reports as they're coming in about money that is available. How much money is expected to come in over the next 5 to 10 years? So I emphasize that we want to be looking not just at money that's coming in this month, but looking, over the long period that we're going to be looking at facilities potentially. Number 5, what new facilities and services might be needed, and how will anything new fit in with the current continuum of care, which is why we're looking at the whole view, so we see how the parts fit together. 6, he said we should strive to have services that place people in the least restrictive settings to meet their mental health needs. So number 7, we need to provide crisis services, but we should also strive for programs and services that prevent crises. Number 8, we need not only to have funds for any facilities and services we create in the immediate future, but must be mindful of being able to sustain any facilities and services over the long term, over 5 to 10 years. And you mentioned, as many of us are aware, of the swimming pool in Fort Bragg, and a lot of money had been raised to develop that, but then evidently not enough foresight into what it would take to keep it going. And he says we obviously need to be very aware not only of what it will take to fund any facilities, but being able to be sure they continue. He indicated he is not looking just within our own county, but using his expertise to see what we have here and what we might need by looking at what other counties are doing. Number 11, he says the report will not be recommending the use of specific facilities. He believes that that is a job of local entities based on guidelines and recommendations of the needs assessment. So in other words, there's not going to be a recommendation that says we should use a specific facility or that, but what are the criteria, what do we need, and then the entities that are affected, depending on where they are, and this committee presumably would be involved in assessing specific facilities. And finally, number 12, the needs assessment will suggest steps that need to be undertaken to move ahead towards decision-making and implementation. He indicated that whether his group, that is a Kemper group, would be involved further would depend on what the Board of Supervisors decided and how best to implement the recommendations. It could include parts of mental health, or if there was a need for more guidance from his group, that would be determined once the board acts on the recommendation. And when I say the board, I mean the Board of Supervisors. So again, I said that these are notes based on the 2 phone conversations with Lee Kemper on July 2nd and July 20th. And he said he'd let me know if for any unforeseen reason there's a delay in submitting the report. But he felt confident when I spoke with him, obviously just recently, that the report would be finished and available by the next meeting of this group. So that's my report.
Any questions about the Lee Kemper report, where we are so far? Jan?
Do we have an estimated date when he comes to the Board of Supervisors? No?
It's going to be ready before our next meeting, so.
That's the 21st. Yeah.
So if he's saying he's going to have it ready on the 22nd, did you say?
He said before our next meeting, we meet again
The
on
22nd.
August 22nd, and the board would have it. So I don't know how
Well,
that ties in with the board agenda.
the report needs to come to the Measure B committee first.
Okay.
And then go to the board. So if he has it ready by August 22nd, it would have to be ready before that, because you have to publicly notice. So if he has it ready by, say, the 15th of August, then you could have it here on August 22nd.
Right. We can go out with the agenda and everybody can
And
read
then
it.
it could go to the board in September.
So the first date for a board meeting in September is the 11th,
Right, that's right.
and our filing deadline would be Monday, the 27th of August.
Well, we could push that back for this committee,
Okay.
so that this committee could hear the report, make recommendations, and then the item that goes to the board will be the report and this committee's recommendations.
So just a point on that, Carla, you might want to talk to him directly, because I asked him that specific question, would it come here first or would it go to the board? And he said unless he heard differently, that it would go to both of us at the same
No.
time.
It should go, okay.
Yeah, so I'm just saying,
Somebody
somebody ought
Sheriff,
to,
would you like me to call him, or Jed could call him since
I think
he's the
it's,
liaison?
I think that because it's a Measure B report, I think we can see it before the board does. I mean, they're gonna get it electronically at the same time we
Yeah,
are, but we'll
no.
have the first chance to publicly discuss it.
I agree, but what Jed is saying
Yeah.
is that Lee doesn't know that, so somebody
I would
needs
like
to
for you
call.
to, if you don't mind.
I will.
So with that report, Jed, and I guess I'm just asking the commissioners here, is there anybody else who has spoken with Lee Kemper or who would like to speak to Lee Kemper? I'm asking the commission first, I'm gonna go public comment in a minute. Is there anybody on the board or the commission that would like to talk to Lee Kemper specifically? Okay, and as far as public comment, we're welcome to address the board or commission if you'd like to discuss this topic. And your name is?
Gregory Sims, and I've been speaking with Jed that I gave you some material initially and came here a time or two. I feel that there should be some time between when the report is prepared for additional comment, addition, changes, etc., before it goes to the Board of Supervisors. Because like if we're talking about, and I don't know, Carmel, if it's a narrow window or if there's plenty of time, because the whole issue of education, rather than just psychological, medical, or psychiatric approaches, I think is a really crucial variable, and I've been working on that, as I've said before. I'm a visiting scholar. This is my second year at Stanford. I have a great deal of information, and Jed and I are making plans to meet. I want that to be reviewed, and when the Board of Supervisors gets the material, that they get it all, and not just the report.
Thank you, Mr. Sims. Any other public comment? Okay, no more discussion about the Kemper report. Okay, moving on to item 5B as in David. City of Willits Resolution 2018-30, response of City of Willits from committee with possible discussion and possible action. Member Gordy, and you asked for it to be pulled off. Let me tell you my thoughts on this. The Willits City Council is a legislative body of the City of Willits, and our Board of Supervisors is a legislative body of the county. So while I certainly do not think that we would be prohibited from discussing this in this forum of what a response could be or should be, as far as the official communique between this board to the city is somewhat inappropriate. It would be more of a governing body to a governing body. So I strongly, and Dan, you were at the last time that the board meeting when I presented to the board of the overview of where we are so far with Measure B Commission. Our role is to advise the Board of Supervisors. So if there's something that we want to address with the City of Willits, I know Jed's our liaison there, so we can do it through Jed, or we can do it through the Board of Supervisors. So that's the reason I wanted to leave it on here, to make sure we all understand that our role is advisory to the Board of Supervisors. Any comment on this? Jed?
yeah, part of what I took on when I joined this board as a representative of the 3rd District, which includes Willits, was to meet with anybody I could to give information and to listen to people, which I've been doing. And that's been informal and just people coming up to me or calling me up on the phone and telling me what they think or questions. It's become more formalized in that we've invited people from obviously anybody to come, but clearly there's been a number of people that have been coming from Willits, including members of the Willits City Council. And I have been meeting with Willits City Council anytime they want to meet, which turns out to be, so far, after each one of these meetings. Willits City Council meets in the evening, so I've kind of extended my day to meet with the Willits City Council and to share and answer any questions with the Willits City Council, and I've met numerous times with the Willits City Manager. So I'll continue to meet with Willits or obviously any of the other jurisdictions in the 3rd District, and really anybody from anywhere that I think we all collectively or me individually, if there's anything I can contribute anywhere in the county to help, us understand better what we're doing, I'm available.
Shannon?
Also, with Dora's help, we're also directly notifying each jurisdiction of the Measure B meetings and any communication related to those. So that's going directly to the city of Fort Bragg and the city of Willits and the city of Ukiah
And Point Arena.
and Point Arena.
With the minutes, I would imagine?
Yes, they've
Okay.
all been added to the public distribution list,
Okay.
and they all received this month's agenda packet.
Okay. Any other discussion on this? Is there any public expression on the City of Willits Resolution 2018-30? Okay, moving on then. Psychiatric health facility, PUF, cost analysis, staffing, can we afford one? And can we sustain one with discussion and possible action, members Myrtle and Miller? And just a reminder, in your packet, you received a, I don't know, 6 or 7 page addendum, license requirements for psychiatric health facilities, PHFs, and it describes the different types of PHFs and the license, the staffing requirements and so forth. Because committee member Miller is not here, this meeting, I'm gonna put it on to put this over to next agenda also, but we can talk about it today. But between now and then, I certainly hope that, as boring as this license requirement is, it's full of good information. And I'd like for everybody to have a chance to look at it and be ready to ask questions on this, because this is one of those things that it's the elephant in the room that we've talked about since the passage of Measure B. Can we afford to staff a mental health hospital with the monies that are coming in? And this clearly talks about the staffing requirements. And Janine did get it's an excused absence from being here today, so she can't add, but I know that Mark was on there also. Mark, is there anything you'd like to add to this?
Well, I got it late last night and I didn't get a chance to read through it, so I really haven't had a chance to speak intelligently about it. But one thing that I mentioned in the last meeting is that I would offer to put costs associated with staffing the facilities, at least take the best guess at it, and some information that might be helpful would be maybe the benefits that would need to be offered for the staffing as an increased cost. So you can figure out what the costs that you pay the employees are, but what kind of benefit package would you add to that as a percentage? Carmel, would you know?
Well, first of all, I have no idea how we're going to operate this, so I guess I don't feel like we're there yet, so, and I missed the last meeting when you had this discussion, so if you're talking about county staff and how we can put together some dollars regarding county staff, or are you just talking about hospital
I would like
staff
to
in
know what the
general?
county staff benefit package is,
We
and
can
that's
get
a,
you that.
that's a
That's not
that's a threshold that we can speak from, and I think it'd be helpful to look at it from both ways. But I think my standpoint would be to try to do it with private dollars rather than public dollars. Private contractors do it, but that's not my decision, that's the decision of the board. But it'd be nice to be able to look at it from two different angles, and these are gonna be educated guesses, these aren't going to be finite details. But if you put budgets that we can look at to say, okay, are we 10% off, or are we 20% off, we can look at it in generalities and know if we can proceed down that direction or choose to go another direction.
We could give you the figures on the cost of county staffing.
That would be great.
And benefits, we absolutely could get you that.
Yeah, that'd be great.
Shannon?
I'm not clear about why we're addressing this item separately.
Kemper,
Yeah, it sounds like, especially based on Jed's report, that the sustainability of a facility is gonna be one of the items that Kemper addresses in his report. So why is this item being pulled out separately?
Because we talked, it was brought up 2 meetings ago regarding the main topic was a different type of psychiatric health facilities, the licensing requirements and so forth. And so this isn't being brought out specifically for the staffing costs, but more in lines of, I think, helping us all understand that a PUF cannot just simply be a PUF. PUFs have different classifications. So that's what this is. The topic went to financial, but the paper was submitted for the licensing part.
Will that not be addressed in the Kemper report?
I don't know the answer.
I think it might be just to wait for the Kemper report to see if that's a path we should be moving towards, but I can start preparing a spreadsheet and withhold it to get them.
Or maybe this
Kemper
is
report.
information that should be provided to Kemper,
Absolutely.
yeah.
All right, Jan.
So I was going to suggest that we have a committee of this group to actually make a matrix of the different types of facilities, because from Jed's report, it doesn't sound like Kemper's going to be recommending any particular type of facility. So we as a responsible group need to understand the different staffing concerns and et cetera with each of these categories.
Shannon?
Oh, I saw that too, when you said it wasn't gonna recommend a specific facility, but then I thought you clarified that to mean, like, for example, Howard Hospital, like a specific location.
exactly.
Like, we would, though, recommend a specific type of facility based on our needs.
That's my understanding, yes. But not a specific
Building.
facility like a building. That would be something based on what's needed, then looking at what possible facilities might fulfill the needs, and then looking at what's
I
available.
wasn't sure about that either.
Yeah, but that's my understanding, was not a specific facility, but I would expect there would be information about different types of facilities.
Is that something you could verify with him?
Sure. So your question is, will he be making recommendations of different types of facilities
No,
that might be
giving
needed?
us that information about the different types of facilities, because I mean, I think we're pretty ignorant. I've tried to research this stuff and it's just overwhelming.
Okay, yeah. Okay, sure, I can ask him if that's,
And if it's not part of his report, then we need to figure it out.
okay.
That's
I
fair.
I will call him right away and get back to the chair so that everybody can get that information.
Any public comment on the psychiatric health facility, cost analysis, staffing, so
One
forth?
more member.
Oh. Wait, I'm sorry, Doctor, hold on a second. Ross?
So, yeah, I've gotten input from several constituents and people in our district about, and it's interesting that the kind of things they're advocating for in a building, and I know Kemper's not gonna recommend a specific building, but hopefully give us some direction on what kind of facility, right? Because I've gotten everything from, hey, distributed care, right? So somebody wants to see something in Covelo and, Walla and Fort Bragg, and some people want to go with just a single facility, and then it hopefully will give some guidance on one or the other, right?
That's my understanding.
Okay. All right. Doc, yes, sir.
Donald Mills Matheson from Willits. There are 29 pup units in the state. I think it would be prudent to call each one and find out what the costs are. And also what the deficits or surplus are. I mean, that's straightforward, easy to do.
So maybe a questionnaire for all 29 pup units.
Yeah, they're listed on the state and with their telephone numbers. And I mean, that gives you the range. The range would be something would be between $4 million to $7 million a year for a pup unit.
So 50% of our counties have pup units.
Yes.
Well, that's scary.
Is
Thank you.
is that true though, or are there more than one in some counties?
Yes,
LA?
Los Angeles has 4.
Well,
So it's less than.
Okay, got it.
Yeah, Los Angeles is 4.
Any other public comment on the psychiatric health facility cost analysis?
Is that a question that maybe we should address with Kemper? Ask Kemper that question to see if he can poll those people as part of his report, or is that?
We have a contract
now?
with them, you know, that our contract's pretty specific.
It's a good data point.
A
so that'd be
survey, a survey would not be that expensive for us to put together the questions and mail them to 58 directors who would actually mail them back to us,
Yeah,
or 29, I'm sorry.
that'd be a good data point to have.
I can ask him when I'm asking whether that's something he's done, or, you know, whether that would be something that he thinks is a good idea, but isn't part of his
Yeah, it might
review.
be.
We could find that out.
Extraordinary too is project stuff. Tell them we'll buy the beer or something next time we come to, I don't know, whatever it takes.
I'll ask him that too.
We will not use any government money for that. We'll give it up.
I'll buy the person.
All right, moving on to item 5F is in Frank, monthly committee update to the supervisors at their first meeting each month. Will be present and what will be shared with the commission or discussion and possible action. I briefed the board just on what has happened as we all go along, including the monies that are coming in. It was a very short presentation. Dan was there, and it seemed to be well received with some interaction with the board of supervisors, but I think that it's a good way to do it, of keeping the board apprised of what's happening so they understand that we're not a government body that's wasting time. We're actually trying to have very meaty meetings and discuss some things that need to be taken care of. So with that being said, are there if you have anything that you would like to specifically be brought up to the front of the board, you're welcome to join us. It's usually on the first board meeting of the month. Those are posted on the agenda or the county website, or you can let me know, but Jan was there, I said, and I would imagine she'll be the next one. So is there any comments on this? Any public comment on the monthly committee update to the board of supervisors at their first meeting each month? Okay, then we are to the committee member reports. Each committee member will have opportunity to report action that they've done over the last month. We'll start with Jan.
Okay. So last week we had our Behavioral Health Advisory Committee meeting. And we had a presentation in the afternoon by Lieutenant Bender from the jail, who shared with us the revised plans for the jail edition, which is really important to note that this is completely separate from Measure B. People are still kind of confused about this. And then we also heard from Jay Holden, who conducts a misdemeanor competency training for people in the jail that are mentally ill. Last week, I participated in the ASSIST training, which is suicide intervention, which was very interesting. And I'm currently reading this book called Insane Consequences: How the Mental Health Industry Fails the Mentally Ill by DJ Jaffe. So I would just like to invite all commissioners to visit the NAMI library, where we have a whole bunch of fascinating books on mental illness and associated topics that will help our education of this whole topic.
Where is that?
564 South Door Street, Suite E.
Sweet.
E, as in Edward.
Any more again? Carmen?
Sheriff, I have nothing to report except I will not be here next month.
Okay, you're gonna be another grandmother.
I have a new baby.
Okay, good.
Good
Ross?
She's your daughter. Okay.
Ross, anything? Lloyd?
Nothing further?
Mark?
I'd wanted to get out and meet with some stakeholders. I didn't get a chance to, but I did hear from constituents concerning some of the same topics that Ross had mentioned, treatment facilities and remote locations, as well as I received a big packet PHF facilities from an unknown person, which was that thick. I need to go through and read. So I don't have anything else other to report.
Okay. Chad?
Just, I think I've reported on what I've been doing and will continue to.
Thank you. Shannon?
Nothing to report.
No, sir.
The only thing I have is the Peace Officer Standard and Training, known as POST, is the training agency administered by the Governor's Office for training of all peace officers throughout the state. And they actually offer a program of trying to stay current onto the best training facilities in the state. So the technological training centers, the physical contact training centers and so forth. And as we know, part of Measure B was for a training facility in Mendocino County, a mental health training facility. So the POST coordinator for our region is meeting with me to discuss in Northern California what he believes are the best training centers. And actually POST will reimburse the costs for a couple people to go look at these and see if they're what we want to look, because I certainly am going to be a very staunch supporter of moving forward with a mental health training facility for our county to keep it in the forefront. So, other than that, is there anything that we haven't done for us?
Not at all.
Okay, then the July meeting of Measure B Commission is over at 1:58. Thank you.